In the economic crisis, public hospitals are needed now more than ever. If you're down on your luck without insurance, the county hospital can be your last resort. Recently, thousands of letters went out across Las Vegas telling cancer patients that the only public hospital in the state was closing its outpatient clinic for chemotherapy. It's the next thing in the recession. Communities cutting back on services like schools or cops or public hospitals because tax revenues have fallen with the economy. One of the charity patients who got that letter in Vegas is Helen Sharp, who didn't realize how a crash on Wall Street might threaten her life.
I don't want to die. I shouldn't have to die. This is a county hospital. This is for people that, like me, many people when they have lost their insurance, have not any other resources. I was a responsible person. I bought my house. I put money away. I raised my 2 children. And now I have nothing. You know, the house isn't worth anything. I have no money. And I said, what do I do? But what do all these other people do after me? And they said, we don't know.
63-year-old Helen Sharp has been fighting lymphoma since July. She's not working because of her illness and has no insurance. Last year, she received charity care at the county hospital, University Medical Center, and she was one of 2,000 patients who got this letter.
Dear patient, we regret to inform you that the Nevada Cancer Institute will no longer provide contract oncology services at University Medical Center.
Since December 31st, no chemotherapy for new outpatients. When you read this letter, what did you think it meant to you?
A death sentence.
University Medical Center is the safety net for 2 million people. Vegas bets its life on it. UMC is a teaching hospital, the only fully equipped trauma center, the only burn unit, the only transplant unit, and the primary source of charity care in a city that has fallen on the hardest times it has ever seen. Kathy Silver signed that letter. She's the hospital CEO.
Obviously, our gaming and tourism is tanking, the construction industry has been decimated, and all of those things cause big gaping holes in the state budget. The hardest hit area for us was the Medicaid budget.
You lost $21 million overnight.
Overnight, and we were already scheduled or budgeted to lose $51 million, and so when you layered on $21 million on top of that, that brought our loss, or anticipated loss, to $72 million.
The $21 million was cut by the legislature when tax revenues went bust. Nevada is #1 in foreclosures. Unemployment is over 10%, double what it was last year, and climbing. Silver told us she had to defend her unique services, like the trauma center, so she chose to sacrifice services that are duplicated at private hospitals, even though patients may not be able to afford them. The services that you have closed include what?
We no longer provide prenatal services. We closed the outpatient oncology program. We canceled a contract for outpatient dialysis. We closed the dedicated high-risk obstetrical unit that we had, and we stopped doing outpatient mammography.
We were there in February when the Women's Cancer Clinic closed.
It's like a, sharp pain. I have to go lay down, can't move.
Dr. Nick Spiritos treats ovarian and uterine cancers.
Oh, thanks for your take care. It's been great working with you.
When the hospital first informed you that the outpatient oncology clinic was going to close, what did you think?
How can you do this to cancer patients? They're dying. If we don't provide them care, their outcome is guaranteed. They're going to die.
We spoke to several of those patients. Roy Scales, a laid-off security guard with lung cancer, went to the hospital and got the news in person.
I walked in, the lady looked down and said, well, I don't see anything down here for you. And then she looked in the computer and she said, oh, you were supposed to have an oncology today, but it's been canceled. Our oncology department is closed.
They turned you away at the door?
They turned me away at the door without telling me anything.
When you walked out of the hospital, what did you think?
I mean, where am I going to find help? I mean, I'm messing with a disease that will kill you. And for every day that I don't get medical input, I mean, this advances on my body.
Cancer is advancing on Livia Ralphs, who was recently laid off from her job selling cosmetics.
Goes from here to here, you can probably see it sticking out.
So in terms of the cancerous growth in your neck, the doctors believe it's treatable, but you don't have a way to treat it.
I have no funds. I have no insurance. Nothing.
Patients who got the letter, like Helen Sharp, who we met in the beginning, were sent a list of private chemotherapy centers, which leaves them, in essence, begging for care.
I was wondering what care is available to me now that oncology is closed. I'm trying to see whether I'm going to die or not. One drug is almost $50,000. One drug, Rituxan. Who can afford that? There's nobody that can afford that unless you're a billionaire.
Some of the patients we met are gravely ill, but all future patients are affected, including those with early, highly treatable cancers who would benefit the most. Kathy Silver showed us her closed chemotherapy unit, which had treated 40 patients a day for 20 years.
Well, I'm sad because I know that there is room to serve patients, and yet financially we can't afford to.
You have the facility.
We do.
To save lives. You have people outside the hospital who need to have their lives saved, and you just can't put two and two together.
The financial situation that we find ourselves in caused us to make some decisions that I think all of us, to a person, would rather not have made.
84, Erica. Number 92, Matthew.
There are 2 medical assistance programs for the very poor, like the folks who line up here before dawn to apply for state services. There's Medicaid and Clark County medical assistance. So if you're poor enough, you're okay.
If you're poor enough, you're fine, because those patients are being taken care of.
If you're rich enough, you're obviously fine. So who's falling through the cracks here?
It's the patients who don't qualify for a social services type of program.
What we're talking about here are people who are making $30,000, $40,000, $50,000 a year and have lost their jobs and therefore lost their insurance.
That's correct.
Middle class.
That's correct.
Yolanda Coleman is 45 years old, a single mother. Her breast cancer has entered her bones. We found her at home, bedridden, with a broken hip. It's hard to know how much she could benefit from chemo, but when we met her, she was receiving almost no care at all. A few months ago, there wouldn't have been any question about whether you could have your next round of chemotherapy. UMC would have been available and you could have gone there.
Yes.
What does it mean to you that that is gone now?
It's devastating, you know. It's absolutely devastating.
She worked her whole life as a maid in hotels and as a truck driver, which was better money to support her 9-year-old son and 16-year-old daughter in the next room. As we sit here at this moment, you don't know.
I don't know.
Whether there will be another round of chemo for you.
I don't know. I don't know. It's just so uncertain right now. I really don't know. I'm just trying to live it day by day and trying to keep my spirits up and trying to keep, you know, trying to get well so I can take care of them two I got in there. You know, I got to take care of them.
She had 3 rounds of chemotherapy under her insurance plan. Then she became too sick to work and lost her insurance. Exactly the situation UMC used to take care of. You know, Yolanda, I think most people watching this interview think to themselves that if they get cancer and they don't have health insurance, that somebody's going to take care of them.
No. No. It's not. No. There's nobody going to take care of you.
Is what's happening to this hospital in Las Vegas unique, or is this kind of thing happening all about the country?
I think this is happening to some degree to probably every public hospital across the country. I think it's happening to us to a greater degree because we're sort of the epicenter of what's happening. We're a demonstration project, if you would, of all the things that can go wrong at once.
Nick Spiritos, the doctor we met closing the women's clinic, has not been able to leave his patients behind.
We've taken care of these ladies for years. They've been in our family. You're not going to push them out in hard times.
He took a storeroom in his private office and spent $100,000 turning it into a chemo clinic for ovarian and uterine cancers.
And you told them they could come here to your clinic and receive free medical care?
Correct. We've asked those who can pay, pay. If they can pay $5 a month, they pay $5 a month. If they can pay $20 a month, we're asking them to do what they can, and those who can do nothing, that's our job to take care of.
Spiritos expects 10% of his patients won't be able to pay, so he and his partners will cover them. They put collection boxes out at convenience stores around town. Other private clinics are also providing free care, and charities, including the Susan G. Komen Foundation, are stretching to help the desperate. But these are emergency measures. After a month of uncertainty, Helen Sharp was treated at UMC. With the outpatient clinic closed, the hospital admitted her as an inpatient. It says it made an exception because her heart disease and diabetes are life-threatening complications. But Livia Ralphs is still searching for care.
I'm going to die if I don't get treated. That's the bottom line here.
Yolanda Coleman remains untreated, and after our visit, a medical supply company took away her bed and her wheelchair.
You never know what God has for you down the road, but I know he has more for me than just to leave my children because I can't have medical insurance.
Roy Scales has been calling the private doctors on that list University Medical Center sent with its letter. He's been searching for someone who will accept payment from the County Medical Assistance for the Poor, something he calls insurance. But it's been 5 months since he was diagnosed.
How many doctors and oncology practices did you call?
Oh man, that'd be at least 25.
And they told you what?
Well, what about your insurance? I told them about the insurance, but we don't accept that insurance.
What are you going to do if you can't find a doctor to take care of you?
Die peacefully.
Roy is now in hospice after finally consulting with a doctor. Yolanda Coleman, the woman we saw in bed, had her insurance reinstated after we called the insurance company to ask why she'd been dropped. The Nevada State Legislature is now considering a proposal to cut millions more from the budget of University Medical Center.